welcome to our first edition of Ask the Eye Doctor with Dr. Yemisi. It's good to have you here. So today I'll be talking about something that comes up, or a question that comes up to me a lot of times, especially when we go on kids' eye screenings, or when I have opportunity to talk to PTAs. And the question is usually, how do I know that my kids needs an eye exam? Or how do I know that it's time to take my toddler for an eye exam? As some teachers would say, how do I know that it's time to call up a parent and say it's time to take your child for an eye exam? So I will just go on to it and just give quick nuggets on how to identify a child who is training and the right steps to take. So let's go on. I'll start by saying that a lot of times kids don't even know they have a problem. So kids do not even know the difference in vision. So they can't perceive that they're seeing better than others, or that others are seeing better than them. So it's a bit tricky. The older children might, because they realize that they're straining to see the blackboard or experiencing some other kind of symptoms. But the younger kids, the toddlers, would most times not even recognize that they're experiencing some challenges or the other. So the onus is on you, the parents. It's on you, the teacher or the guardian, to watch out for these signs that I'll be calling out or dishing out today. So we're gonna start with the regular one. I can't see the blackboard. So when you notice that a child is straining to see the blackboard at regular distances, or you notice that the child always has to come to the front, I've had cases where children will come in or referred from the teachers. Kudos to the teachers. I like to digress by saying that, to be fair, on a ratio of 1 to 10, about 8 times, 80% of the time, kids come into my practice for an eye exam, it's because the teacher has noticed and has called the parents' attention and referred to the parents to say, oh, it's time to have your child or your ward go do an eye checkup. So thumbs up to the teachers. So let's go back. So most of the time, this is the first symptom that kids experience, or you notice the blackboard in school. They're struggling. They're struggling to write. So what happens is that they're the last to finish up their writing work. Or when you take the notes, you see that the notes are not coherent, because the child is actually straining to see the board. So that's one sign we should all watch out for. Especially now that the kids might be going back to school soon, it's something to watch out for at home, in school, especially in school, when the child is struggling to see the blackboard, either at the kindergarten stage or older kids, is one of the signs to watch out for. Another sign to watch out for is squinting, squinting like this. So just as a matter of coincidence, just this week I had a kid who was referred to me, and that's because the kid had gone to play somewhere else and then another parent had noticed that the young beautiful girl was squinting a lot to see. She was squinting to watch cartoons, she was squinting to play. There was just a lot of squint going on, and another parent had said, oh, this squint doesn't seem normal, or it's too much. I think it's time to take this child for a checkup, and that's how the child was referred to me. So a squint is one thing to watch out for. A couple of times I've even had patients with squints, pediatric patients with squints, where you find out that there's one opacity, childhood congenital cataract, or the other. So the squint is very important to watch out. If you notice that your child is squinting, your baby boy, your girl, your boy is squinting a lot to see things that are far or even things that are near. Sometimes they squint with the eyelids closed. They're very uncomfortable with lights, So they experience a lot of difficulty with light. So you find the kids doing this. So that's one very important, because I mean, it doesn't necessarily, it is not simultaneous to the fact that the child might just need glasses. There might be other things going on. So a squint is number 2 reason, or number 2 symptom to watch out for. Sometimes some kids experience head tilting. I mean, naturally you find out that kids would always lean, you know, to get comfort, to some kind of succor. But when you notice that a child is trying to focus with their sight, and whilst trying to focus, the child is squinting, tilting their head, so bending to one side or the other because the child is unable to see, it's another time to have the child come in for an eye test. Tilting can also indicate crossed eye in kids. What happens is that the eyes are not lined up properly, and eventually, if not managed on time, one eye becomes weaker than the other. So head tilting is also a symptom to watch out for. And when one eye is working better than the other one can become what we call a lazy eye or amblyopia. So one eye is lazy to focus because, you know, this to see. So that's one thing that we should watch out for, so that it doesn't eventually become a permanent visual problem, you know. Reading with one eye. That's number 4, reading with one eye. When you notice that your child is doing this to read, or you notice that not just to read, but the child is more comfortable with one eye to focus, what might be happening is that the child is using more of the comfortable or the good eye to focus. The child is using more of the comfortable or the good eye to focus. So that's why this child does this, or patches. I mean, kids play, you know, when they try to act like pirates. I mean, that's different. But when you see that this is a continuous character displayed by the child, that is something to watch out for. Number 5, we're number 5 now, and that's poor reading comprehension. Now there is dyslexia with kids, that happen with kids. It could be as a result of visual problems, neurological problems, ENT challenges. But now I'm talking about difficulty with reading comprehension that comes as a result of the eyes really trying to focus. So when you notice that your child is finding it difficult to read, what is most likely happening is that this child is having difficulty with focusing with both eyes at once. So not in other words, the child is having a hard time working with both eyes, you know, at once. So with something we call stereopsis, you know, the child is finding it difficult to work with both eyes at once. So that's why it can cause a bit of decreased reading comprehension. And you when watching out for this is notice more with close work. When I mean close work, they're playing with close-up toys, writing, scribbling, but there's this not that the child is not intelligent, not that the child is not wanting to catch up or not interested, but they're just struggling to have both eyes focus at once. So it delays understanding comprehension, because in the process of that they're experiencing a huge degree of pain or struggle. So number 6, using the fingers to track words when reading. I mean, it's not all bad or all gloom when you see that happen, because some kids are taught to read that way. So what happens is that when the child is trying, you know, learning the phonetics, blending words, sometimes I haven't taught like myself, but in the process of teaching the kids to read, you probably might have done tracking, or the child has learned to blend words by hand tracking, finger pointing. But when you see that that's not the case, instead is a situation where the child is actually finding it difficult to follow the words and read properly. What this means is that their tracking muscles is not working efficiently. So that's also a sign or a symptom to look out for. When you see that happening and you have negated the fact that it's not as a result of learning to read, then it might be a challenge with the muscles not working as efficient as they should. Number 7, lots of eye rubbing, and I see that a lot. It's cute, rubbing of the eyes, but lots of rubbing of the eyes could also be a telltale sign of something else happening underneath. Sometimes it could just be allergies, recurrent allergies, recurrent eye infections, and it could also be a habitual rubbing. So some kids rub their eyes. It's just like a response to make sure that they see clearly. So the thing where you're looking and it's a bit blurred. Sometimes you blink to try to see if things will get a bit clearer, and sometimes you do this. Yes, that is what the child is doing. So when there's a constant rubbing over and over, every time you see the child struggle to focus, he or she has to rub the eyes before seeing. The child is just trying to get things a bit clearer, and that's also one of the symptoms or one of the signs to say it's time to take this child to have an eye test done. Yeah, and the final one, depth perception. So when a child, not all kids would have inherent sports abilities, but all kids like to play. They love to play. And when you see that your child shows symptoms of being a bit clumsy, so when you see that your child is acting a bit clumsy regularly, things are dropping off from their hands, they find it difficult to run on a straight line, not the funny inter-house part this time, but when it's a regular behavior, that child might be experiencing a bit of visual problems or challenges with depth perception. So that's also a good time to have your child go see an eye doctor or go for a checkup. Why is an eye check important for kids? It's very important because the earlier a problem is found out, if there is any, the better the chances of treatment or management. So early interventions, early eye test is very important. Then it brings me to the next question: how soon should I have my child do an eye exam? Usually, the general practice is about 72 hours after birth. So that's while you're still at the hospital, most likely, while you just had your baby. Some hours after, while doing the general test, the doctors will also want to check the child's eyes to see if they're perceiving vision or if there are any other problems. After that, the rest of the responsibility is on you. And so when is the next time to take your child to have an eye test done? Between 6 to 8 weeks. Yes, 6 to 8 weeks. That's usually a follow-up exam. At this point in time, not just the eye test is done, a lot of the general tests are done, but this should range between 6 to 8 weeks. So at that time, it's important you also have your child's, your baby, toddler eye test done. And then when next? Yes, between 1 and 2. So in this part of the world, at that time, you're thinking of getting them into KG or preschool or something. But between 1 to 2, if you have any concerns, if you're noticing any symptoms, it's a good time to take your child for an eye test. Afterwards, no problem. Another good time to take your child in for a test is between 4 to 5 years old. That's also a great time for us because we have more objective answers. They can actually talk about their symptoms to a large extent of how they feel. So it's also a good time to take your child for an eye test. And if there is any need for patching, patching is done. There are a couple of tests that they do at this time: the red reflex test, the pupil reflex test, attention to visual objects, and so on and so forth. But those are good times to take your toddlers in for a test. And the last thing I would like to talk about before we leave is how to pick an eyewear for your kids. I think that's another challenge. So for children who have been diagnosed with a refractive error, I mean myopia, hyperopia, long-sighted, short-sighted, astigmatism, lazy eye, one major challenge I know that parents find themselves in is picking an eyewear selection. So I'll just talk a little bit about eyewear styling for kids. How do I pick a good eyewear for my child? First of all, the material. The material is very important. So yeah, how do we pick an eyewear for kids? There are a few considerations that I try to educate parents about whenever it's time to pick an eyewear for the kids. And I'll start with what kind of lenses are they getting? What's the prescription like? Is it a very high prescription? Is it a low prescription? Will the prescription require that they use large frames or smaller frames? So if you find yourself in a situation where your child would have to use be prescribed with thick lenses, probably the high minus or high plus, I always advise that you use smaller frames, not big frames, not the big round ones. Small frames are always very good. The reason is because the big frames create an illusion of the lenses being very thick, and then once anybody sees their child, they're like, oh, what's going on? Oh, the lenses are so thick, and you get unsolicited comments. But there's just an illusion that comes with smaller frames where the edges, the thick edges of the lenses are not that obvious. So I always suggest that you go for smaller frames if the lenses are going to be very thick. So the next thing is choosing a very modern design. So whether you accept it or not, kids are very fashion conscious. Yes, and they show this among their peers. I have the green glasses, I have yellow glasses, my glasses are finer than yours. Not out of comparison, but one way to encourage your child to wear their glasses is by getting something very attractive, very colorful, something light, something modern. So yeah, that's one other thing. So I would always run away from boring colors for kids, brown, black. I know you're a conservative parent, but allow this child to be a child. So I always go against parents who come into my practice and want to pick brown, black for a 4-year-old or 5-year-old, even sometimes close to teenage years. So get something very attractive to encourage a child to wear the glasses. Also, aesthetic add-ons to lenses can make them very comfortable to wear. The anti-glare, the photochromic lenses, once they're in the sun, it goes a bit dark. So those things are very fascinating. They bring in more comfort. That's another way to encourage your child to make sure that they're wearing the glasses. Yeah. So another thing to consider, am I going for metal frames for my child? Am I going for plastic frames? I always tend towards plastic because a lot of kids have skin allergies. I feel it's lighter, it's more attractive, it's more colorful. So I always find myself on the side of plastic frames. However, in recent times, manufacturers and designers have come up with very nice metallic frames for kids, attractive styles, and they try to put in those other components, so making it light, designs. So I mean, that's one thing to consider. Metal or plastic, durability, which is more durable. Because another thing I noticed is that some kids in a whole school term, they will lose their glasses back to back. So That's another thing. So talking about back-to-back price, so you want to get something quality at also an affordable rate. So that's another thing to consider when picking an eyewear for a child. Something that is quality, comfortable, but still at an affordable rate, because the chances are that they will lose them or break during one very intense play or jump or something like that. So that's for parents out there, price is a good thing to consider. Then the bridge fit. Yes, the bridge fit. When I mean the bridge fit, you know how the eyewear rests on the nose is usually the toughest. So what I find is that sometimes you find eyewears that suit the face and size, but the bridge fit is always a bit delicate because the kids are still growing, especially their nose. Their nose bridge is still developing. So always tries to make sure that outside the fashion, the color, make sure it's something that is going to sit properly and is going to give comfort to the child. You don't want to pick an eyewear that will be too tight. You don't want to pick an eyewear that will also be falling off the nose bridge. It's going to be very uncomfortable for that child, and after a while you might notice that they stop wearing them. So that's very important. Then the right tempo style. Yes, the right tempo style. This is what I mean by tempo. This is the tempo. So this is the tempo, and there are different tempo styles and tempo designs. You know, like this bends. I have some other ones that extend, and you can bend them. So the right tempo style. Why is this important? This is important because you want the eyewear to sit properly at the back of the ear. It gives more comfort, it prevents it from falling down, but you don't also want it to be too tight, because if you have the tempos too tight over here, they cause a lot of discomfort to the kids, and they can express what they're feeling, but they're not comfortable. For adults, sometimes it even leads to some degree of pain. So the right tempo size is also very important. The design of the temple as well. If it's something you want the child to wear a bit longer, especially for a growing toddler, you want something that curves, that is flexible, so that you can either extend or curve it downwards to give them comfort. Sometimes you want to slip in eyewear ropes, you know, to give a bit of more comfort at the back. So that's also very important, the temple size. Next is the lens material. What kind of lens material are they going to be using for the lens? I always recommend Trivex or polycarbonate for children. They're lightweight, they have good clarity, and a lot of the manufacturers manufacture them with a bit of anti-scratch and UV protection, because they're on their phones. The kids are on tabs these days a lot, especially in this season. They spend a lot of time on the computers or the tabs on the TV. So I would always go towards the polycarbonate or the Trivex, and lighter lenses, no matter how high the prescription might be. In fact, for higher prescriptions, I always tend towards polycarbonate lens, and my reason is that they are lighter, they're also comfortable. Okay, so the next is sports goggles. So if your child plays a lot of sports, if you have boys who have to wear the glasses almost all the time and they need it to see, it's always important to get them sports eyewear. Yes, you're tempted to use the regular glasses for sports, but the design of the regular eyewear do not have that side protection as compared to something that was designed for sports. It protects the eyes, it protects the lenses from getting broken. It's always good to have that backup sports eyewear for kids that are very active, or teenagers, preteens that are involved in cheerleading, basketball, tennis, whatever sports. Very important, and it makes them do their best because they can see clearly. Talking about backup, it leads me to my last point, and that is having backup eyewear for your kids. You can never go wrong with backup eyewear, because like I said earlier, a lot of times the kids will always be kids, so they're prone to lose them, they're prone to break them, they're prone to come back and say, "Mommy, somebody broke my glasses," and all kinds of stories. So it's very important to have backup for your kids. Always have a backup. In case something happens and they need to go to school tomorrow, they have some pre-test or test in class, it's always good to have a backup. Parents always have a backup for that child. Having said that, I'll just like to reinforce again that it's very important to have your kid, watch your kids, watch out for signs, take them for a test if necessary. I'll close by telling a story. I have a patient who told me how they came to start wearing their glasses. So she realized at a tender age that she wasn't seeing properly. I think at that time she had gotten to about age 8, and she kept on telling her parents that she wasn't seeing properly. But you know, sometimes we don't take our kids seriously and we don't even investigate what is going on. And this was her case, and it was very late before they found out. In that time, she had struggled so much educationally, struggled to see. She was behind the class. Reading was a problem. Seeing things afar was a problem. And her eyes had become a bit amblyopic. Remember I talked about amblyopia, lazy eyes. So her eyes had become a bit lazy over the years. So it's one thing that really gets to her. And that shouldn't be your child's story. So rather than sticking to ideologies and myths, and I hear some people say, oh, my child will never use glasses, it's in your best interest to take that child for an eye exam if you notice any of the symptoms. I know you love the kids, and this is one of the ways to show them how much you love them as well. Thanks for joining me today. Thanks for coming on the Insta Live or watching our videos wherever you are. I hope you had a wonderful time with Dr. Yemisi on our Ask the Eye Doctor show. Thank you, and I'll see you next time. Bye.